Hi, my name is Catherine Price and I'm a physical therapist. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. Today I'm going to go over a rehab program that I do for patients that have a disc herniation that can be conservatively managed. First I'm going to speak a word of life, and it's John 14:27. Peace I leave with you, my peace I give you. I do not give to you as the world gives. Do not let your hearts be troubled and do not be afraid. So today I'm going to go over exercises that I give to help patients manage a disc herniation conservatively. This is to avoid any further damage that can occur in the back. So first, what is a disc herniation? We have cushioned cartilaginous discs that are stacked between the vertebrae of the spine, between the bones of the spine. And it is a circular disc. I did draw a picture. It looks something like this. And the outer layer is called the annulus, and that's made up of collagen fibers, similar to what you would find in ligaments. So it's ligamentous tissue, and the center is just fluid. And so what happens with a disc herniation is that fluid in the middle of the disc gets pushed into the ligamentous fibers and it tears them. It is similar to spraining your ankle or any other ligament sprain that you would have in your body. This is just going to be a sprain in the back, and it can be very painful. Those fibers have a high nerve supply, and the pain is trying to tell you something. So that's dangerous pain. We don't want that fluid to be pushed through. If it goes into the spinal canal, then it can be past the point of return, and that's when you're going to need medical attention and see a doctor for further intervention. But if this is bulging out, you can press on a nerve root, so you can get symptoms that go down into the leg. If you get pain into the buttocks region and pain that goes down the back of the leg but not past the knee, that can be discogenic pain and coming from these fibers. So it's telling you, hey, there's a problem here. Address this so that you don't do any further damage. So how you injure this, if you are sitting in bad posture and slouched and putting a lot of pressure on your back for a long time, working at a computer, or sitting for periods that do not have good posturing position and strains those ligaments or sprains them because you're pressing that fluid into the ligaments and tearing them. So that can cause the disc to herniate. You can lift something heavy and that takes that fluid in the center and pushes it on the fibers on the backside. And so these are the fibers on the backside of the body that are being torn when you're in that position. And that's most commonly how disc herniate is going to be a posterior herniation, usually back, and sometimes to one side. So it could be the left and to the right, and there's exercises to address the direction of the herniation as well. So these are the typical exercises that I would give to correct this problem. And if it's a disc herniation and can be managed with exercises, the exercises are usually pretty effective. So the first thing I want to show you is going to be a back extension. So the fluid is pushing backwards on the ligamentous tissue. So we want to push the fluid back off of those ligaments so that they can heal. Now, folks that do have disc herniation are likely to re-herniate in the next 2 years. About 80% will re-herniate in the next 2 years if stabilization exercises are not done. And my question as a therapist has always been, well, why is it within 2 years? Well, that outer annulus is ligamentous tissue, and it takes about 1 to 2 years for ligaments to heal and to remodel. So if you can protect the back for 1 to 2 years after those ligaments have been torn, then you can give them opportunity to heal and have a successful management of the back. So if you're in an acute phase where the fibers are actively torn, just as if I had just sprained my ankle, the first things you want to do right away is going to be managing that first before you can do any other work. So I don't do any stabilization or exercise work until the disc and the acute tear has been managed. So the first thing is going to be to push that fluid forward And I'm going to use the back of a table, the back of a couch. You just want to support the lower part of the back. And then I'm just going to gently rock back. If you're having pain, do not do this. If the pain is in the center of the back, that is okay pain. If the pain goes down the legs, that is dangerous pain. It's a red flag and you want to come out of that. So what I want to do is just rock back and forth. It should feel good. If I have a disc herniation, this usually feels pretty good to the back. So I'm going to do this about 30 times just to take and push that fluid back to the center where it belongs. And so I'm just going to rock back and forth and do this 30 times. I'm going to do 10 more. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now, if I have pain that's going down the right side of my body, then I'm going to do this differently than if I have pain down the left side of my body. So for this purpose, I'm going to say I have pain down the right side. So if I'm getting pain that goes down the back of the leg on the right side, what I want to do is I've probably got a disc herniation that is backwards and to the right. And so I want to push that fluid over to the left. To do this, I'm going to hold on my hand on my right hip and I'm going to lean to the left and I'm just going to push that fluid over to the left. And then I want to do this about 30 times. If I have pain going down the leg when I do this, I want to stop. So any pain that goes into the leg is dangerous pain. That is a red flag. And so I am just going to be pushing that fluid back to the left side of the body. The next thing I'm going to do, so if I have pain in standing, because sometimes the just standing can put pressure and that may not be a good starting point. So if there's pain in that, don't do that. The next thing I'll have you do is come onto the floor and I'm going to do prone press-ups. Now, a lot of mistakes, folks want to put their hands underneath their shoulders and press straight up. That's a lot of compression in the back. I'm going to put my hands out in front and I'm going to then just press up and come right back down. And I'm going to do this 10 times. 3, 4, 5, 6, 7, 8, 9, 10, and then I'll take a pause. So you want to keep your hips down onto the table and you want to press up. If there's pain going down the leg, you need to stop. If the pain stays in the center of the back, that is fine. If it is a disc herniation, usually this is going to feel good to the back. 3, 4, 5, 6, 7, 8, 9, 10, and I'm going to take a pause and then do 10 more. So I'm doing 30 back bends, 30 side bends if I have pain to one side, and then 3 sets of 10 prone press-ups, keeping my hips down and just pressing, extending my elbows. If you haven't done upper body work, this usually can also get the arms tired quickly. 8, 9, 10. Then the next thing I'm going to do is go into prone on elbows. And I have an ice pack. So ice packs can come in handy. What you can do, you'll go back onto your stomach, and you want to get onto your stomach usually by keeping your spine neutral. So if you come down onto the floor, keep your spine neutral, rolling onto your stomach, and then I'm going to place this right on the small of my back and go up onto my elbows. Now I'm going to pull my elbows back towards my feet, so I'm tractioning my back, and then that allows me to get a little bit of traction while I just stay up onto my elbows. Now I'm gonna stay in this position for about 5 minutes. Again, we're taking that fluid and pushing it back to the center and getting that pressure off of the ligamentous tissue. So I just hold here for about 5 minutes. And again, if you wanna pull your elbows towards your hips, it just tractions the back to allow you to get to that negative pressure that helps pull the disc material back in where it's supposed to be. So I'm just gonna hold that for about 5 minutes. Now, after I have been on my elbows, prone on elbows, I am then going to go onto my back and I'm gonna get a chair and I'm gonna put my legs up over the chair in a 90-90 position. So to show you that, I'm gonna use this chair. And you can get to a couch, you can use the edge of a couch, and you can do all these on your bed or on elevated, on a table. You don't need to get down onto the floor, and getting up and down off the floor will be very difficult when you have an active disc herniation. So I'm gonna come back onto my back and I'm gonna use the chair and I'm gonna get in that 90-90 position. This gives natural traction to the back. It's also the strain counter-strain position or positional release for the psoas muscle, so it relaxes the muscle that attaches to the front and into the groin, which can be a culprit in disc herniations. Now, this is an astronaut position. It is just unweights the body and unweights the spine. If you have an ice pack, you can place that under the small of your back and you can rest in this position with the ice pack. The ice pack is just to decrease the inflammation in the disc. If you've got inflammation, that can further cause swelling that then presses on the nerve roots. So you want to get the inflammation down. Cold is usually a good way to do that for an acute injury. Just as if I sprain my ankle, I want to stick cold onto my ankle to mitigate that swelling. So I would hang out in this position for 5 to 20 minutes, and this is what I would end with. Those are the acute or the beginning exercises that I typically do when there is an acute phase of a disc herniation. The disc needs to be calmed down, and until I proceed further, I want to centralize the back pain and keep the back pain right in the center of the back before I proceed with any stabilization work. So those are the beginning stages, the acute rehab for a disc herniation. I hope that this has been helpful and will serve you, and have a blessed day. Thank you.